Hey guys, Courtney comes to us with a question today wanting us to talk a little bit more about hyperbaric oxygen, Heliox, and inhaled nitric oxide. So we're going to break this down for you as quickly as I can, but hopefully as sufficiently as I can also so that you learn something from this. So let's jump right into this. Let's talk about hyperbaric oxygen. So the functioning aspect of hyperbaric oxygen is to increase the pressure gradient of oxygen. So typically we think of oxygen, partial pressure of oxygen at atmospheric pressures, okay, is 21% of 760. Okay, now when you talk about hyperbaric oxygen, you're going to increase the pressure at which oxygen is delivered. So you're no longer talking about delivering at 760, you're talking about sometimes up to 1.8 times as much as that. Okay, so that's how hyperbaric oxygen works. Now the question and what you really probably want to know is, when would hyperbaric oxygen be the answer for a patient that I'm taking care of? Okay, so the most common use of hyperbaric oxygen, let me take it back. Probably not the most common, but one of the most common things that should come to mind is patients who present with decompression sickness, also called the bends. Okay, this is commonly associated with scuba divers. So scuba divers either go down very, very deep levels, below sea level into the water, and they stay there, either go very, very deep and stay there for a long time, or reascend too quickly. Okay, the pressure differences affects the lung and the gas exchange in the lungs, and hyperbaric oxygen is used to correct and treat those effects of decompression sickness. I'm going to put it up here. One of the things that should come to mind is decompression. I'm just going to put DS, decompression sickness. I'll put bends out here so that you understand we're talking about what we're talking about. Okay, now the other time you'll see hyperbaric oxygen used quite frequently is in wound care. So you have somebody with a severe wound that won't heal, either a decubitus ulcer or an amputation that the leg is the whatever I said leg, but whatever was amputated isn't healing appropriately. Okay, then you'll see hyperbaric oxygen used to enhance the oxygen delivery to the tissues to promote healing. Okay, so decompression sickness and wound care. Okay, those are your two big things you should think about when you think hyperbaric oxygen. Okay, so and that pretty much covers hyperbaric. Now there's more to it. Obviously, you can have mono chambers, you can have multi chambers where you treat one person at a time in a mono chamber, or you treat multiple patients at a time in a multi chamber. Okay, that's obviously true. Okay, but if you think hyperbaric oxygen, you think decompression sickness associated with scuba divers. This is also the same case for very high altitudes, as well as astronauts. Not as common as scuba divers. I was reading up on this, and it was saying that in a year, approximately 1,000 scuba divers are treated for decompression sickness. Okay, so obviously the more common illness that comes with hyperbaric oxygen is going to be decompression sickness, along with wound care. Okay, remember, the way it works is by increasing the pressure gradient. Okay, that's hyperbaric oxygen. Now, when we talk about Heliox, we're talking about airway obstruction. Now, airway obstruction is a big term, right? It can be asthma, where you have severe bronchoconstriction, which creates an obstruction to airflow. Okay, or we could be talking about like tumor obstructions. So more than one type of obstruction here. So don't just think just asthma, don't think just tumor growths or things like that. Airway obstructions that can't be removed with a bronchoscope, okay? If somebody aspirates a peanut, we're not going to give Heliox, we're just going to go in and remove the peanut. Okay, so don't think that. Think more, like I said, severe asthma or some type of obstruction due to a growth that needs to be, if possible, surgically removed Now, the way Heliox works is that it's less dense than helium is less dense than oxygen. Okay, so when you combine them, you create a gas that delivers oxygen, but at a less dense state so that it moves through or around these airway obstructions easier to promote better distribution of gas. Okay, so that's the how does it work is because it's less dense. Okay, so you need to know that about Heliox. Now the other thing is to know the concentrations in which Heliox comes in. Okay, and there's three of them. There's 80-20, 70-30, and a less common that you'll see 60-40. Now what you have to understand is that this column is the helium, this is the oxygen. So if you have somebody who's not able to maintain an oxygen saturation on room air, then 80-20 is not going to be enough by itself. Okay, so I've seen it where they put Heliox over, like in a non-rebreather, over a nasal cannula. That might help, okay? But you have to understand that the second number is the oxygen concentration. So don't think when you put somebody on 80-20 Heliox, you're giving them 80% oxygen. Not true. You're giving them 20% oxygen, 80% helium, okay? Now, for your board exams, you're going to see this question come up where they're going to ask you what the flow coming from the flow meter is. So you can deliver Heliox through an oxygen flow meter, okay? But because the oxygen flow meter is not regulated to Heliox, then whatever you set the flow on is not the actual flow coming through the device or coming from the flow meter. So if you put it on 10 liters, then it thinks 10 liters of oxygen is coming through. But because Heliox is less dense, there's actually more gas coming through than what the actual 10 liters is on the flow meter. So you have to know your conversion factor. Okay, so here's the conversion factor for Heliox, and you have to know these. Okay, so for 80-20, it's 1.8. Now, how do I remember that, Joe? Well, 80 here, 1.8. Okay, is your conversion factor. So if you have somebody on 80-20 Heliox, flow meter set on 10 liters, oxygen flow meter set on 10 liters, then what's actually coming out of the flow meter is actually 10 times the conversion factor is 1.8, actually 18 liters. Does that make sense? The flow is going to be higher than the actual set flow because the gas is less dense. Okay? Now, from here, that's the only trick I got for you. I wish I could say I got another trick for you, but I don't. Okay? That's the trick. Remember, 80-20 is 1.8. 70-30, you go down by 0.2. So 70-30 is 1.6. 60-40 is 1.4. 4 here, 4 here, and that's your conversion factor. I just realized that was another trick to remember. Okay? So 80-20, 1.8, 70-30, 1.6, 60-40, 1.4. You always want to use a non-rebreather to deliver Heliox. The bag should be fully inflated and partially deflate on inspiration. That's proper use of Heliox. Okay? That's what you got for Heliox. Now the last one is inhaled nitric oxide. What's our indication for inhaled nitric oxide? It's very simple. Pulmonary hypertension. Why is pulmonary hypertension an indication for inhaled nitric oxide? Well, it's because inhaled nitric oxide is a very potent vasodilator. So it will actually vasodilate the pulmonary vessels and relieve the pulmonary hypertension, which means the right side of the heart does not have to work as hard to perfuse the pulmonary circulation. Okay? Now I have seen, outside of pulmonary hypertension, I have seen people have repair surgeries on pulmonary arteries, and the focus was to keep, very rare, I've only seen this once or twice, but they want to keep the pressure down in the pulmonary arteries, so they put this patient on inhaled nitric oxide to to cause pulmonary vasodilation, which would release the pressure and remove some of the pressure on that repair site of the pulmonary artery. Okay? But for the most part, just remember pulmonary hypertension. Now, what's funny about this is a lot of people running around there with pulmonary hypertension that aren't on inhaled nitric oxide. Don't forget, oxygen is also a pulmonary vasodilator. Okay? So we're talking about severe cases of pulmonary hypertension when you're talking about inhaled nitric oxide. Now, the thing to remember about inhaled nitric oxide is that it can lead to an increase, I'm just going to put increase in MET, but what I'm saying is MET hemoglobin. And an increase in MET hemoglobin can cause MET hemoglobinemia, okay, which simply means this, okay? An increase in MET hemoglobin increases the affinity for oxygen to the red blood cells. So the red blood cells don't want to let go of the oxygen to the tissue. Okay? So as MET hemoglobin goes up, you need to understand that tissue hypoxia is a concern. Okay? Tissue hypoxia is a concern. So if you ever have a patient on inhaled nitric oxide and you notice that cyanosis is appearing, you need to ask yourself if this is a problem. Now, in general, what they say is you want to keep this less than 5%. And when you hook them up to an INO, you'll see where it gives you a MET hemoglobin reading. You want to focus on keeping that less than 5%. Your facility you work at may have a different number, lower than that. But this is in general, a lot of the research is showing is keep it less than 5%, and you'll reduce the risk of tissue hypoxia due to the increase in MET hemoglobin. Okay, Courtney, this didn't answer your question. Send me another question in the comments, send me another email, let me know. I'll clarify it even further. To the rest of you guys, I hope this helps. I hope everybody's off to a fantastic semester, whether it's your first, third, fifth, last, it doesn't matter. Hope everybody's having a great time in school as the semester starts up this fall. Okay, best wishes.